This recording is meant to be a quick update or quick review of obstructive sleep apnea for the physical therapist. The assumption is that you already know a little bit about obstructive sleep apnea, and we're just hitting the high points for you. So what is obstructive sleep apnea? It's upper airway obstruction during sleep. There's something happening in the airway itself that's causing the person to have that collapse. So the person typically is laying supine when they're sleeping because of the breakdown of something in the airways. The smooth muscle is not as active as it should be. There's been damage over the years for a variety of different things, or sometimes obesity is a risk factor, and just the weight of the tissue in the neck itself actually leads to a closing of the airway. Okay, so the person actually stops breathing during sleep. The body senses this, they get a buildup of carbon dioxide, acidosis takes place, and they get jolted awake. And they wake up, their body kind of goes into an emergency state where it gives them this quick jolt, they're up before you know it. I always say it's like pretend you were sleeping at night and someone came in every hour or two and just shook you violently to wake you up. That's kind of what your body's doing because you stopped breathing. You see some of the risk factors that go along with it. Men tend to be a higher rate, obese, larger neck circumferences. So some of it is body shape, body size. Some of it's genetic in nature with the structure that we were born with. Some of the things you might see with this is fatigue during the day. So someone's really tired during the day, have trouble staying awake. Snoring at night, I always like to point out that just because you snore doesn't mean that you have obstructive sleep apnea, but if you have obstructive sleep apnea, you tend to be a snorer. So just understand that relationship there. The increased risk of cardiovascular disease, this is something that has gained more and more importance over the last probably 5 to 10 years. Think about the stress on your body every time your body violently wakes you up. Think about that hormonal release. Think about the lack of deep sleep that you're getting. It puts more stress on all your systems, but especially your cardiovascular system. And there's even evidence to show that patients who don't get a full night of sleep, they end up gaining weight. Their body doesn't have time to recover. They're in this state of stress. The cortisone or corticosteroid response or the epinephrine response in their body actually facilitates some retention of weight. So there's issues that go along with that. So these people tend to be overweight too, which then of course feeds into even further problems. Treatments. The tried and true treatment is a CPAP machine. So we have our sleeping patient and we have that increase airway pressure, we have the narrowing, we have the weight coming down on it. What CPAP does is it tries to keep that airway open. The patient wears a mask or a cover their mouth and or nose, depending on the patient. The pressure, continuous positive airway pressure, blows into the mouth, down the airways, causing a counter pressure to keep the airways open. So the patient's able to breathe at night and not have that airway collapse. Some patients do need oxygen therapy, medication, not many good medications for this. Surgery is an extreme case. The outcomes are not very good for this, and again, the risks are pretty high to have surgery and have your throat surgery to try to keep the airway open. CPAP is really the tried and true. There are oral appliances that can be used to keep the mouth open. So we think about this as the physical therapist. We think about obstructive sleep apnea being a comorbidity that's probably present in a lot of our patients. We're not going to directly treat sleep apnea, but our patient who comes in with fatigue, they come in with a lot of pain, they don't feel very good, and you can ask about their sleep pattern. You can ask about if they snore. They can ask if they've been looked at for sleep apnea. If you're in a cardiac situation, maybe a cardiac rehab setting, it's not going to be uncommon to see obstructive sleep apnea. And managing that, the theory is that will decrease someone's risk for a future cardiac event. So it's something we need to be aware of, understand, know when to refer back to the doctor, know when to be able to talk to our patients about this, because this truly does have implications across multiple systems, but especially the cardiac system.